Hello, everyone. I'd like to welcome everyone to this Duke University School of Medicine dialogue regarding support for teens and young adults during this pandemic. Please note that this webinar is being broadcast live and recorded and will be made available to a wider audience at a later date. We're so glad that you could join us tonight. This discussion is particularly timely and urgent as young adults, teens, and families work to navigate an already complex decisions and challenges against the backdrop of these extraordinary times. My name is Maura Rinn, and I serve as the chair of the Psychiatry and Behavioral Sciences Department within Duke University School of Medicine. Over the course of my career, I've had the opportunity to partner with families and experts across the country on how best to support children, adolescents, and young adults in their ongoing mental health needs. Over the past several months, the work of guardians, educators, and providers has significantly increased. This crisis has highlighted the unique needs of teens, young adults, and their families. The confluence of existing stressors that are typical for teens and young adults, like balancing schoolwork, building educational resumes, managing relationships, finding footing before leaving home, are all a bit more complicated during this global crisis. As an academic medical center and leading university, Duke is fortunate to serve as a source of reliable and responsible information about matters of public health and mental well-being, alongside matters of learning and discovery. Joining me in this important conversation are two of my Duke colleagues and experts in health and education, Dr. Gary Bennett and Dr. Charlene Wong. Over the course of our careers, we have served adolescents and young adults through many challenges as well as many growth opportunities. We hope you leave this program with key takeaways on how to support teens and young adults in maintaining health, continued learning and leading, and building sustaining practices to improve mental health. During the program, we have organized our conversation to answer as many pre-submitted questions as the time allows. The Q&A function is open and will allow you to send questions privately to our team. We received such a high number of questions during the registration process, which we appreciate greatly. However, it is unlikely that we'll be able to get to all of your questions. It is our intention to send a document addressing unanswered questions to attendees in the weeks following this event. With that, I will open the discussion with brief introductions. Charlene, may we start with you? Would you let us know more about your background and touch a little bit on how young adults can take agency while mitigating risks during this time?
Yes, thank you so much. I'm Charlene Wong, and I'm an adolescent and young adult medicine pediatrician at Duke University. I'm also a health policy researcher. And during the COVID-19 pandemic, much of my work has focused on the impact of the pandemic on young people, from younger children all the way up through young adults and their families. And Maura, to your question about how young adults can take agency, I think the first thing to stress over and over again is that we all, teens, young adults, faculty, parents, everyone, really need to be following the 3 W's to help get this pandemic under as much control as quickly as possible. So just for those of you who don't know, that means wear a mask, wash your hands frequently, and wait 6 feet apart. That is the best thing that young adults can do to be a good role model for their friends, and to set this as a social norm that this is something that we should all be doing. And then I'll add, beyond following the 3 W's, which we should all be doing, I would really encourage young adults, as we have seen so many times over and over again, including from many of our Duke students at the undergrad and graduate levels, to use some of their energy and perhaps newfound time to contribute to the COVID-19 response, because there are a lot of needs to be met. And we don't have to look very far to find some wonderful examples of things that young adults have already done that have made such meaningful contributions to the pandemic. I just wanted to highlight a couple from our Duke students, actually. One is that we had a group of very entrepreneurial students who made a COVID contact tracing app very early in the pandemic that was downloaded by thousands and thousands of people and continues to be used to this day. We also had a wonderful group of undergrads who, in our local area in Durham and Orange counties, recognized that early in the pandemic, so many of the resources and community-based organizations that provide such vital services to our community, like food and housing and healthcare, were opening and closing on a daily basis and had different hours because things were so unpredictable at that time. And this huge team of students came together and were calling these organizations every few days and updating a live repository, which is now being turned into a website. Those are just a couple of examples of how young adults can use that agency and use their efforts and passion to really contribute to the pandemic.
Thank you. Thank you, Charlene. And Gary, you have a unique perspective at Duke in that you have a background in health and also work directly with the undergraduate population. Would you tell us more about your work and how we should think about balancing positive reinforcement of guidelines with the need to have clear responses during this time?
Yeah, sure. In fact, yeah, I'm a clinical psychologist by training, and I've worked in public health for a long time. And I run a lab here at Duke where we design digital health interventions for a whole range of cardiovascular conditions. I think many of my colleagues over in the health system didn't even know that I was actually appointed on the undergraduate side when I joined the administration in 2018 as Vice Provost for Undergraduate Education. And now I kind of oversee the undergraduate programs at Duke. And, I guess I'd say that we've thought about this issue a lot over the last couple of months as we've been fashioning Duke's return to campus. And, we think about this balance as being motivated by a couple of key principles. The first is really just uttering complete empathy for our students' situation. They are experiencing something, and this is something I'll say a lot tonight. They're experiencing something that none of us have, and that no one really in human history has. It's quite a set of challenges that they're facing. In the world of public health, we believe that mitigating public health challenges really requires attention to policies and practices and structures and systems, more so in some ways than does a focus on individual behavior. And so we've been thinking a lot about how you balance those things. Of course, this is a situation where we're asking a lot of people, and young people in particular. But yet we want to make sure that we have set the stage appropriately, that we have the right policies, that we have the right practices, so that students are better able to make the kinds of behavior changes that are going to be necessary. We focus heavily on the importance of making those changes to protect the community's health, not just focusing on any given individual, but focusing on that bus driver or the person who is the landscaper who you see each and every day. We try to reinforce our messages through attention to those kind of community level factors. And, I'd say that our real focus is on changing social norms, not changing individual behavior. We will have more of a chance in this pandemic, both at the sort of university level, but also in the family level, if we make these changes normative. That is, you should feel like everyone is kind of doing this thing. Everybody is wearing the mask. Everyone is social distancing. And so, we have a very rigorous testing protocol. I think it's been a very, very important component of our return. And yet I think one of the most important parts of it has been just reminding students that we're in a pandemic and that we need to have attention to these kinds of behavior changes. We've set very clear expectations, hopefully in a non-draconian way. And we've made our accountability mechanisms very, very clear. The worst thing that I think we can do in a pandemic like this at the university level, at the family level, at the sort of secondary school level is beat up on our students, right? These are changes that require time and attention and skills, and again, the right kinds of policies and practices to make those behavior changes easier to.
Thank you very much. For myself, as chair of the Department of Psychiatry and Behavioral Sciences, I've been hearing this question a lot lately. How do I know the difference between the level of anxiety or depression that is appropriate for this time versus a level of anxiety, depression that was outside, that may actually need assistance? And I just want to help us all take a step back and just look at where we are and what our young people are experiencing. There's a lot of ongoing uncertainty and bracing for the unexpected, and they also having to pivot quickly to respond to changes that come along. We've had the disruption of the education world, work and home, blurring of those boundaries, remote working from home and learning, all family members together in a space that they have to navigate, childcare challenges, managing finances, and most important for teens and adults, a whole new world in terms of the social challenges. In addition, our youth are witnessing and experiencing very difficult times for us here in this country, where we're seeing systemic racism and injustice towards people of color that continues, and these current events, like the pandemic, as well as the stark reality of police brutality that we've witnessed, and with the pandemic shows clear poor health outcomes for people of color. That has been reflected during this time period. It's really important for us to help in this current time, that we're able to have really open and clear conversations with our young people about these times and to really encourage them to share their reactions and thoughts and fears. So it's understandable that at different points in time through this time period that we're going to see complaints about difficulty sleeping, feeling very anxious and stressed, really wondering about one's future. And this is typical in terms of these acute reactions to the things that we see going on around us. Each of us have our coping mechanisms, so does our young people, such as talking to loved ones, trusted friends, using relaxation techniques, using distraction, music, movies, games, exercise, and so forth. And a lot of these coping strategies can help very well for most people. However, if it changes, if it seems like these reactions are growing or changing in ways, such as these symptoms are increasing in the amount of time or intensity, such as ongoing sadness and irritability that's present most days, and or with ongoing worries, unexplained physical symptoms. So someone that's been to the doctor multiple times and the doctor reassures them that they are completely fine. Trouble sleeping, either not getting enough sleep or sleeping too much. Significant appetite changes, and that can be both increased or decreased. Overwhelmed by schoolwork and relationships and just feeling like one can't move forward with their day. Very importantly, I want to stress to everyone participating tonight is the expression of any thoughts of wanting to die, feeling hopeless or trapped, unable to identify reasons for living, or feeling unbearable pain, or a sense that one is a burden to others. This is extremely important to take note of this and to ensure that you reach out to get additional help for your young person who might be experiencing this. You also want to look to see if it's a significant change from one's typical self of coping and behaving. Other unhelpful coping strategies that we can see young people turning to is increasing use of alcohol and drugs to manage. So if you see any of these types of symptoms or a combination of them sort of increasing and taking a certain amount of their time and impairing what they do normally, it would be really important to seek professional help for the teenager or the young adult with any of the number of these symptoms. And then speaking of managing stress and having clear information about what to expect, so Charlene, could you please provide a brief view of the current knowledge of effects on COVID-19 on the young adult population?
Yeah, Maureen, just to follow off what you said, several of my patients have described, particularly with anxiety, really feeling sort of like stuck in a panic attack. This was certainly even more pronounced in my clinical practice earlier in the pandemic when, things are still uncertain now, but they were really, really uncertain at the beginning. And those were the words that actually a couple of my patients used who are young adults. So I just wanted to share that.
Thank you.
So what do we know about COVID-19 in young adults? When you look across the country at young adults, and for these purposes, I'll define those as 18 to 29-year-olds, our young adult population accounts for the greatest number of infections in our country. That is almost a quarter of the infections we're seeing in the country are in the young adult population. That is over 1 million cases in the United States among young adults as of this week. So what we know from those rates is that COVID-19 spreads easily and can spread very quickly among young adults. We also know that young adults can become very seriously ill with COVID-19. We have had almost 1,000 young adults die of COVID-19, so unfortunately, already in this pandemic. Luckily, however, young adults are representing a very small proportion of the deaths that we've seen in the United States, and we'd like to keep it that way. The problem, in addition, because we know that young adults are getting COVID-19 so quickly, they are spreading it to other people. So they are the source of infection to other people that they are in close contact with. Perhaps that's an older family member or a friend with a chronic condition who would be both at high risk of severe COVID-19 illness and much more likely to, potentially die from the illness. And so talking about mitigation of risk, I just want to reiterate again, our 3 W's: wear your mask, wait 6 feet apart, wash your hands. I also just want to say, because I've seen on Duke's campus and really in much of the Triangle area where we live, we are seeing lots of mask wearing, which is wonderful because I think, Gary, we are getting towards more of that social norm. Just want to emphasize how to wear a mask because I see too many people, including even some in our own clinic, whose mask stops here. We want to make sure it covers the nose and the mouth and that it's got a good fit at all times. And so just a reminder there, because it would be such a shame if somebody has actually taken the bother of putting the mask on, but then it's hanging out underneath their nose, and so they're still sweating droplets. And then the final thing I'll say, and I'll come back to this one over and over again as well, is flu shot, flu shot, flu shot. Flu shots are now available. We all need to get our flu shots, even more so this year than prior years, because we have seen in other countries, and we will see in this country without a doubt, co-infection, meaning being infected with influenza and COVID-19 at the same time. And that is going to be a setup for even worse outcomes for young people and older people. And we want to get everyone flu vaccinated as quickly as possible this year, because we don't know when flu season will end up hitting.
Sorry about that. I gotta get myself unmuted. Thank you, Charlene. I do have a follow-up question for you. What about students living on campus? We know that eating with others increases the risk of transmission of COVID-19. Is there a safe way for them to be eating with their classmates or friends?
Yeah, so I think the first thing is that as much as we're able to limit eating in large groups, that would be best. However, we also know that some level of social interaction is important. Eating is a very social activity. One thing that I encourage, and I'll come back to this again also later in the webinar, is this idea of quarantining, where you decide who's going to be your team of folks that are going to be your little pod during the pandemic. And with that group, you all agree we're going to ascribe to the 3 W's. We're going to be as careful as possible. And then you're still able to have that social pod with which you can have socialization, doing things like eating. If you are going to be eating in a group in public, certainly the more you can do that outdoors, the better, certainly much better than doing that indoors. But again, we want to make sure that people understand they still can have social interactions, because that is so important. And it's just the way in which you do that and the people with which you do it, and trying to keep that sort of circle of your quarantine as consistent as possible.
Thank you. And for Gary, remote learning has unique challenges. How are you guiding concerned parents, faculty, and even peer groups on paying attention to signs of distress and attending to student needs during this time of limited person interactions?
Yeah, it's a particular challenge because we, part of the de-densification strategy that we've employed both on college campuses and in primary and secondary schools means taking a lot of the humans out of the space that would normally be involved in monitoring students' functioning. And so a lot of that hard work is really falling to our faculty, and they really are on the front lines in ways that I think they have never really been before. So we're really working with faculty, and I'm trying to work with faculty in other types of school systems to be able to recognize many of the signs that you mentioned earlier, Laura. I think that's critically important. And for parents, I think having a good open line of communication with teachers and faculty is a really important part of this process. At Duke, we've tried to increase the number of resources, of emotional health resources, and in non-traditional modes of connection. So, we have our counseling and psychological services, but we also have a psychology clinic that's offered at Duke. We have a remote kind of telehealth service. And whatever kinds of strategies we can employ to ensure that we are touching our students, we're working to leverage. We've trained a whole series of other types of providers, of whole person kind of health coaches in the space who can be available to students as they need them. And again, the idea here is to just make sure that we have people who have eyes on our students and our young people at any time. Certainly peer support is really critical, and there are things that young adults will say to their peers that they won't say to anyone else. And I have to tell you, one of the things that I like the most, and it's most exciting to me about this moment in history, aside from all the pandemic stuff, 2020 has been a problem in so many areas, but in this one, I'm actually enthused. And that is, for generations, we in the mental health space have been longing for a moment where help seeking and just discussing mental health challenges would be destigmatized, where it's be a normal sort of factor in our lives. And in so many ways, with the generation of young adults that I encounter, talking about mental and emotional health challenges is just becoming quite normative. If anything, though, I think we have a slightly different problem. And I'm really glad to hear you more walk through the signs of kind of clinical distress, because in so many ways, many of the students that I encounter, the young adults I encounter, parents have worked really hard to reduce sadness from their lives. And so it can be hard for students to experience completely normative sadness. And to be clear, in the midst of a pandemic, this is the time when feelings of loss and sadness and even grief are actually quite normal and should be experienced. And to a point at which, we don't want them to impact functioning in the way that you described earlier. But I think that, so a lot of the time that we're spending right now is saying, this is a bad situation. It's bad for a lot of people. There's a lot of uncertainty in this moment. A lot of the things that you've looked forward to are not existent in this space. And so it's okay to grieve that a little bit. That's okay. And I think this represents a real turning point for many of us. And so I think parents have to get some comfort having those conversations. Peers have to have some comfort having those conversations and holding sadness and sort of negative mood in its space and just allowing it to exist, being a comfort to other people. And I think the other point I'd make is that Charlene's point is a really important one, which is that the one characteristic of this generation that is really very salient is that they are looking for engagement. They're looking for involvement. They want to get involved in the kinds of big kind of social challenges of the day. And I strongly suggest encouraging our young people to kind of move in that direction. It's a great type of distraction that also happens to kind of leverage their attention in ways that I think can be very, very helpful.
No, that's excellent points, Gary. And in addition to that, to the typical challenges students are facing, they're also having to face keeping up with their coursework. Teens and young adults are actively learning within a system that's being modified, adding to already overwhelming time in life. There are conversations taking place on how families, faculty, and then future employers should adjust expectations in order to encourage teens and young adults to focus on their health and not get burned out.
Yeah, this is all we talk about. I feel like I am encouraging our teams to be flexible multiple times an hour, and I don't really have to. I think flexibility has become the ethos of this place and of many of the communities in which we travel. We are trying to do a lot in the classroom to be more flexible. Faculty are encouraging students and engaging students in more flexible ways. Our academic deans, our academic policies, we're changing every 15 minutes in ways to make them more flexible to our students. And I know a lot of other universities and schools are doing this kind of thing. We are moving test optional for college admissions, as are so many universities around the country. And I hope that this will release the pressure valve on our students a little bit. We actually have very few in-person final exams planned for this fall, which I think many will be conducted asynchronously, I think, which will help as well. I have to tell you, I remain quite concerned about this notion of keeping up and this idea of kind of remaining in the rat race. I encounter students today pretty frequently who feel like they have to maintain that competitive edge. And for so many of the young people that we encounter, they are just on a treadmill where they are just gunning it, trying to check every box at every moment of the day in order to try to achieve their ambitions. And it's a wonderful thing intellectually. It's a real challenge when it comes to their emotional well-being at any time. Certainly the pandemic that we were discussing before this one was the emotional well-being pandemic. And I think it's in large part because of that kind of ethos of just kind of pushing forward. At Duke, we're seeing a huge increase right now as students have less in-person kinds of things, for in-person activities to do. We're seeing a huge increase in involvement in clubs and other kinds of virtual activities, which again is sort of a wonderful thing if it's intrinsically motivated, if it's the kind of thing that students want to do because they're fulfilling a passion. If you feel like you need to try to do these things in order to fill out a resume or a CV or a college application, then you create the kind of conditions, I think, for burnout that we really want to try to avoid. So I'm trying to encourage everyone in the same way that Charlene was a moment ago to really engage deeply in the kinds of things that you're once passionate about and those kinds of engagements that you think are going to really matter and really speak to your core values. And incidentally, that's a better way to get into college and to grad school as well.
Thank you. We've had a lot of questions about how to help teens and young adults remain focused and energized, and how to stay active during this increased time of sitting, just like we're all doing in front of our screens here. Charlene, how can parents help teens and young adults stay focused, energized, and active during this time?
Well, first of all, I want to make sure I get bonus points. I'm actually standing right now.
I thought you were. I thought you were. So yay! Good job.
So, Maria, it's such a good question. I mean, I think that the need for all of us to stay physically active during this time has never been more important. I'm going to use a couple of references to younger children because I have children who are not quite into their teen and young adult years yet. And also so much of my work during the pandemic has also been thinking about our K to 12 younger students in this pandemic. And so I know what a lot of the elementary, middle, and high schools, but certainly our elementary schools, are really encouraging kids to quote unquote move their bodies, having breaks during their classes, actually having the teachers build that into their classes where they're actually getting the kids up, still on video, moving their bodies to different YouTube videos and things like that. Just reminding parents, teens, and young adults that being physically active is not only good for your physical health, and I just wanted to put one note in there, and I know Gary does work on this too, we are seeing a lot of worsening of things like obesity in young people, and adults for that matter, because people are just being a lot more sedentary. People's eating habits have changed as we're sort of hanging out at home all day. Perhaps I have a lot of young adults who have told me because they don't really cook a lot, they're just running out to get fast food even more than they used to. They just have soda at home and they drink it because they're bored. So really making sure we stay active for physical health. It also gets back to what we've been talking about so much today, emotional health. And then a quick reminder, it also helps with your academic health. You do better learning and better work when you have been physically active than if you're just being sedentary. So that's the first piece of advice, is just to get up and move your body. Also, to stay focused, we need to remind our teens and young adults and ourselves that sometimes we need, again, what they call in elementary school, brain breaks. If you're having long online classes, it's very different than when you're sitting in a 3-hour course in person. If you're trying to do that 3 hours online, or you're like many of us going back to back Zoom or Google Meet or whatever platform you're using, it's so important to take some of those brain breaks in between those different meetings. For those of us who are running meetings or teaching young people, trying to make sure that we're ending, those meetings or courses with enough time for people to have those brain breaks so they're not having to go back to back. A second thing is to just to celebrate small achievements for parents and other adult supporters of teens and young adults. This is a time, even things that maybe in quote unquote normal times would have just sort of gone on by because these types of things happen on a daily, weekly basis. Now is the time to really celebrate even those small things. Getting through a full day of courses. I've been very surprised, for example, when I ask my teenage patients who are in high school remotely right now, some of them, their schedules, they're really online essentially all day, like 8 to 3 with very, very few breaks. And even celebrating the fact that they made it through their day and got some or most of their homework done that they were assigned. We should celebrate those small achievements as everyone is trying to figure out, how do you get that right balance? And then finally, I just want to hit back to, Gary, what you just came back to as well, which is helping our teens and young adults find some of those ways to do good. I think so many teens and young adults really have that inner drive, that intrinsic drive to want to help. I will also say, at least from the students and staff I've worked with, it also helps sort of alleviate some of that anxiety because it's something that you're able to control and feel like you're contributing and doing something good in this world where there's so much uncertainty. And one special plug I'll put in for our college students and our high school students as well. There are a lot of young children who are struggling very mightily during this time of trying to remote learn. Kindergarten, first grade, sixth grade. And there have been examples of across the country, and we'd love to see more of this, where we can pair college students and older, like high school students, with some of those younger learners who perhaps have a single parent who has to go to work during the day and isn't there to help a remote first grader trying to figure out learning how to read, where they can't text their teacher to say, hey, I don't understand, because they don't know how to spell yet. And the more that we're able to make that sort of pairing, talk about making a real difference. That's going to make a difference for that child's life now and over the course of their life. If they're able to try to maintain, especially for some of our most vulnerable young children who tend to be children of color coming from poor households, particularly those living in rural counties where their broadband may not be very good. There are a lot of even more widening disparities they're just so troublesome to think about the impacts that this is going to have on these young people, children, really over their lifetime. And the more that college students and high school students are able to step up to the plate and help those young people, again, that would be really impactful.
That is great. Thank you, Charlene. And just sort of building on what Charlene just already launched and talked about is sort of the screen time and how do we manage it? Because it is a lot of screen time, particularly with academics now being mostly virtual or you're in combination of in-person and virtual. So one way we look at it is that not all screen time is equally bad, I should say. Listening to music, reading a book. I saw my daughter, she was on her iPad for a little bit and I had to ask her, I couldn't help myself. It seems like you've been on that a while. And she says, Mom, I'm on to my second book. So I was like, okay. So watching TV, all of these things have provide different supports for our young people. There's certainly the helpful aspects in terms of connecting with your friends and family. We need the educational applications. The challenge is implementing the healthy limits that Charlene's talking about. And we do know from research that increasing actual recreational screen time to a greater extent than some of the other types of screen time have been found. Some preliminary data is suggesting it can impact a young person's mood, sense of self, sense of their physical self, and anxiety. So we do want to have a careful understanding of how much that they're using. But a very important area of concern is in terms of sleep. Is their screen time impacting the amount of sleep that they're getting and the quality of sleep? Sleep is very important for many health reasons. Both Gary and Charlene do research in this area, such as with weight, the immune system, and then of course mental health. So when possible, if you can work in collaboration with your young adult or teenager to see if they'd be willing to stop using their electronics 60 to 90 minutes before bed. Put those electronics away. If it's possible, out of sight, out of room. I know that's challenging. That might be a lot to ask for, particularly when space might be an issue. They're doing work in their room, but clearly delineating what's bedtime in their bed, not having electronics versus what's at their desk doing their work. And I recommend trying to get them to have a routine or a ritual of ideally using that time to read or take a shower, which can be a little bit of a challenge with adolescents. So it's a good time to get those kinds of things taken care of, packing up their books, get them to take a walk around the house. Another key issue with this in terms of managing screen time is really how we as parents and caregivers manage our own screen time. We need to model the same practice. And I will say that I am guilty and I'm constantly struggling, not taking a look one more time of the latest feed of my emails or some news and so forth. And I have really made a real challenge to myself not to do that. But the more that we can model these healthy practices, it will help our teenagers as well see how important it is to have a healthy balance with your screen time, physical activity, and your sleep. And then for each of our panelists, I would like to see if you could please answer to this next question. What can parents actually say yes to? What is really okay to do? I'll go first. I got the easy one, walking outside, socially distant, right? They can do that. They can potentially socialize with somebody if they're at a right distance. Better yet, if they're wearing that right, they need to wear their mask outside. Other things?
Go ahead, Gary.
Okay. So, all right. So, outside sports, distance sports. So, for example, I started playing tennis with my youngest, which is dangerous because she hits the ball really hard and tries to hit me. But nevertheless, you can remain more or less distant. She's 7, by the way. And, it's frightening. I think that can work. The other thing is, I heard a colleague today told me that she took her family out for a picnic, which just sounded absolutely delightful. And and we know that family meals are kind of a wonderful thing.
Yeah, and I'll add, I think these outdoors activities like hiking, biking, running, walking. My children are really into scootering right now. Are both safe, and we know that nature in and of itself is such an important medicine that can be used during such uncertain times and can really be impactful on physical and mental health.
But we all agree this is hard.
Hiking,
right?
biking.
Yeah.
It's hard.
It's hard. It's hard.
Very
They're
hard.
missing a lot of key things that they want to do, right? Sitting together with movies, with their friends, so we do know this is hard, but hopefully some of these tips are helpful. Gary, we received quite a few questions from our participants on how to help young adults navigate in the following areas. living independently while back at home, transitioning from college to the workforce during this time period, how to encounter young adults who are out of school and cannot find a job.
Yeah, so I always start with the thing that I tell my students, which is that that I strongly suspect that they're going to tell their grandchildren about this moment in history, with the same kind of air that our grandparents told us about the Great Depression. And this is really a consequential moment in history that has changed so much about the way that they are living their lives, the way they're going to live their lives. Like, the students that came to Duke this fall didn't have a high school graduation. They didn't have the kind of normal events of their senior year. And Mercy, they're starting their first year completely devoid of all the usual first year excitement. And they have some excitement, to be clear, but not the usual excitement. And so I think starting from a place of empathy is an important start. And I try to encourage our parents to avoid minimizing the complexity of this moment, to try to avoid the over relating. Well, when I was such and such, I remember it was bad for me. Like all of that kind of relating. I think the most important thing that a parent can do in this moment is to listen. Just listen without judgment, and just be supportive, which requires listening and being empathetic, and being really just very supportive, not feeling the need to share as much as you are listening and really showing that you're doing that well. I, again, would think that this is a really remarkable moment for a lot of young people to engage in something that very few of us get a chance to do later in life, and that is to reflect and to spend some time really thinking critically and deeply about the kinds of things that we enjoy doing and the kind of mark that we want to have on the world and our families and our communities. And that's really important time. I encounter so many young people who 4 or 5 years out of college come back and feel like they're in the midst of midlife crises because they have made career decisions, life decisions that were motivated by aspirations that weren't their own. This is a great time and a great opportunity for people to really engage deeply in reflection. And then, the other thing I think is important for parents to remember, particularly over here in the US, is that we are outliers. So that is to say that the past 2 to 3 generations in Western societies are the ones that have created this idea that people should move out of their families' homes and move away from their families. That has never been a thing in human history. It's not a thing in most of the rest of the world. And so the idea that your kids are back with you is kind of the way the rest of the world lives its life and the way that we have lived our lives as humans for a long, long time. It may not be such a bad thing. Now, I'm not arguing that you should invite your kids into your basement and that's going to add a lot to your quality of life, but it might. Yeah. It might. And so I think it's important to be open to that.
Yeah, no, that's great. And I'm going to go off script a little bit just to say we've gotten one comment of something that young people can do, which I think is great, fostering adopting dogs or cats. So I think that's a great suggestion.
I've heard of a lot of pandemic pets, not even just dogs and cats. There seems to be a lot of pandemic pets.
Right.
Just don't pass them off to your parents. That's
right.
That's
right.
thing.
You've got to keep them. Okay. So Gary, from your perspective on the academic side, and Charlene, from your perspective on the health side, how would you answer the questions? What should families do if their teen or young adult tests positive for COVID-19?
All right. So from the health side, there's a lot that you can do to help your teen or young adult. The most important thing is that if someone in your family, teen, young adult tests positive, you must try your hardest to isolate effectively. That means not going to school, not going to work, not going to public areas, not taking taxis or public transportation. And I'm emphasizing all of this because we have had not malintention, but many patients and families in our own practices who have broken their isolation because they just didn't realize what they were doing was breaking the isolation and putting other people at risk. For our teens and young adults, particularly if they're living at home with other people in the household or living with roommates. Luckily, in our older ages, they are able to try to sort of really isolate themselves within the house as well. I have some patients who have really just stayed in their rooms, their family left them their food outside their door, and in those families, only the teen got sick. No one else ended up testing positive. It is a long haul though, because you need to try to stay isolated until it's been at least 10 days since your first symptoms. So at a minimum, if you test positive, 10 days, you are really trying to stay isolated by yourself as much as possible to protect those around you, those that you love. So 10 days since your first symptom. You also have to have no fever for at least a day without taking meds. So if you're still taking Tylenol or ibuprofen around the clock to keep your fever down, that doesn't count. You have to have no fever without meds. And then third, the other symptoms have to have improved, because we know that some patients, some people who have had COVID-19, they can have pretty long-lasting symptoms, things like chest discomfort, cough, body aches, but those need to have improved. If all three of those criteria are met, that's when someone's able to come out of isolation. The second thing family members can do is to help their teen or young adult participate in the contact tracing. What contact tracing's purpose is to help identify as quickly as possible anyone else who might have been exposed to, say, your child who was diagnosed with COVID-19. Because what we want is for those people who might have been exposed to quarantine, which is essentially like isolation, it's just a different word, but sort of wall themselves off as quickly as possible so that they don't become a spreader. And if we can do that more effectively, we'll have less of these super spreader events that we read about in the news, because people are effectively isolating and effectively quarantining from the contact tracing as quickly as possible.
Gary, anything to add?
Yeah, I think, I pick up there on the last point about contact tracing. Part of getting engaging in the contact tracing practices requires kind of disclosing that you've come down with COVID-19, and this may seem obvious, but I think disclosing to one's teachers is a really important part of this. I think I know that there are concerns about stigmatization, but I think I think at the level of most schools, and certainly at the university levels, where we've become quite immune, pardon the pun, to this kind of thing, and in fact, quite the opposite. We have a whole host of accommodations that can be leveraged to try to help the academic engagements to go more smoothly. And so disclosing and kind of talking to a dean or talking to a teacher or a faculty member, a trusted adult in the academic or the school space, is the first step to kind of getting those accommodations. Fortunately, I think if many young adults may have relatively few symptoms, and so remote participation in school may still be possible. But if there are symptoms and it's not possible, or if a student wants to take a slower course, that's completely reasonable, and in most cases totally possible. So I'd encourage them to disclose and avail themselves of those opportunities.
Mm-hmm. And Maria, can I add two other quick points?
Please do. Please do.
One thing just to emphasize is that you cannot test yourself out of isolation or quarantine, meaning even if you test negative, you still need to ascribe to that minimum of 10 days when you're isolating yourself. And the reason for that is that our COVID-19 tests are not perfect. And there's actually a bunch of different COVID-19 tests that people can get these days, which perform with different levels of, we call sensitivity or specificity, or like how good are these tests at picking up COVID-19. And so the reason we say you can't test yourself out of isolation or quarantine is because you may still have the infection and be infectious to other people, yet a test would read as negative. And because we want to not infect or, not put people at risk of infection, we want to make sure that you do the full isolation, the full quarantine, not testing yourself out. The second point to make is we know that some young adults, particularly college students, are potentially moving home when they find out that they have tested positive or they need to quarantine, and they say, oh, I think it would be a lot more comfortable, or I have a bunch of roommates, I can't stay where I'm living right now. It is very, very important as they are making that move back to wherever it is that they're going, that they do that in as isolating a way as possible, meaning if they're going to drive themselves, drive by themselves. When they get to wherever they're going, say their parents' house, they sort of go directly from the car to their room and really try to stay there as much as possible. What we're very fearful of, and we will probably see some of this, luckily we haven't seen that much, is, for example, as there have been some major outbreaks on college campuses, Fortunately, Duke has done such a spectacular job. We are not seeing the same sorts of outbreaks as we've seen in other institutes of higher education across the country. As those students head back home, they are seeding new pockets of COVID-19 all over the country. And so we just want to be as cautious as possible when going to isolate, whether that be in your dorm room or back with your family or elsewhere.
Thank you. And I think along this lines, it's also important for families to have a plan if their young adult at college is having any mental health challenges, so that they know at the institution what the resources are, who they can contact, how they can quickly access help. And I think it's also true for parents and the caregivers and adults to take good care of themselves as we want to support our young people to do, so that the symptoms that I described earlier, particularly when they are getting more troubling or becoming more problematic, hopefully should be a sign for all of us to also then look to get help for ourselves. And when we model that type of self-help seeking, it really communicates a positive approach for our young people to care for themselves and for their mental health. And exactly as Gary said, the one thing with this pandemic has really made very clear is the need for mental health, and to be sure that people are getting the help that they need and access to it. And I'm going to very quickly take one quick question here or comment. Charlene, we have an attendee who says, I love the idea of teens and young adults helping younger students. Any suggestions on how a young adult could get connected in a safe way?
Yeah, so, there are so many, what young children need, particularly is one-on-one attention. And unfortunately, our school systems and God bless the teachers in our K-12 system, and particularly those who are teaching younger children. They are even, I know, running pre-Ks. Many pre-Ks are trying to run online for 4-year-olds. What those children need is one-on-one attention from someone who can help guide them through their various apps that they need to access in order to do their work. And then most importantly is actually help them with some of that learning, particularly our younger children who are really trying to get some of those core skills like reading and writing and basic math. And just a little bit of that one-on-one time can make such a huge difference. For many of our younger children, their teachers in schools have minimal capacity to do almost any one-on-one time with these children. Maybe it's once a week if you're lucky. And so if college students could do even virtual, we're talking about virtual here, virtual connections one-on-one with a student, that can make a huge difference. There are tutoring services that offer that. They are very pricey. And for our most vulnerable families, that is well outside of what they're able to afford for their children, who are probably the ones who are also already starting at a lower level for grade. And so looking for, and there are many programs, if you just Google wherever you are, college tutoring for children in COVID-19, you are likely to make a hit on some organization, some student group that has started a group to do just that in their local communities.
Thank you. And Charlene, I think I know the answer to this, but I'm going to ask it anyway. How should families prepare for winter when we may have the flu and the COVID to manage? I think this is good to remind everybody.
Yes. Everyone get your flu shot, flu shot, flu shot, flu shot. And right. Teens, young adults, adults in the family, babies in the family, you can get it starting at 6 months old. We are hoping to see, and it seems like we're on track to potentially increase our flu vaccination rate this year, which is what we would love to see across the country, because this is something that we all can do. We talk about taking agency. This is something we all can do to help protect ourselves and our loved ones in our communities.
Yeah, thank you. And I can't believe it. We're coming towards the end of our webinar, which is amazing. This has been so much fun. It's been great to work with both of you. I want to show my gratitude to my two wonderful colleagues and their talents and all their expertise that they shared with us. So I want to thank Gary and Charlene for their deep compassion for young people and the care that they are providing them. Before we do, though, sign off in these last few minutes, would each of you reflect briefly on one personal thing that you've learned about parenting during the pandemic? Who would like to go? You want me to go first? Okay. Well, the one thing that I've appreciated more so than ever during this time with my teenagers at home is that you've got to be ready to talk to them when they're ready to talk. You kind of have to do it on their terms, and it can be day or night, and it's been in the middle of the night for my teenagers, and it's well worth it because they need their time to process the information that you're giving them or the may take multiple conversations about wearing your mask, keeping distance, all the wonderful things that Charlene's told us to do. I'm seeing my teenagers now finally very comfortably wearing their masks. It took some time. And good listening, as Gary mentioned, and just being available and being there for when they want to talk, whenever they need it. Charlene, do you want to go next?
Sure. I think I'll go back to, what Gary said he's been doing with his teams, which is, just learning that my husband, the people who help care for our children in this time, we need to be flexible, because just as soon as you sort of find one thing that you think might be working, the school decides to change something on you, and then you need to be flexible to adapt to that. I think more like you, children are processing through things at different speeds, and as different things hit them, they hear something on the news, they ask a question, they sort of process through that, and needing to be flexible in the way that we're supportive of our children during this time. I will also just add to be okay with knowing that you might choose to do something that is different than those around you, including perhaps your family members and your close friends. The decisions being made right now, and certainly the question I get asked most frequently by patients, by media, by others is, should I send my child to school or not? Because we do have K-12 schools that are open. And I just want to emphasize that it is such an individual decision that each of us makes as we weigh the risks and benefits of school or work or whatever decision that you're making during this pandemic time for your family, because no one else knows all the things that you're weighing in your mind. Perhaps you have someone living in your household who has a high-risk chronic condition, or perhaps your child is really doing poorly in remote schooling because it's just not a format that is working for them for learning. And that's the reason, even if you have someone higher risk at home, maybe as you've done your own weighing of your risks and benefits, you've made that decision. And so for everyone just to feel okay that what decision they make is the right one for their family, and you don't need to be the same as other people around you.
That is so good and so true. Yeah, just thinking about Maura talking about her teenagers who want to talk whenever they want to talk. I was on a call maybe a couple hours ago now, and my youngest, I have a 7-year-old daughter and a 10-year-old, and the 7-year-old escaped her virtual experience and came down into my office, and while I was leading a meeting, and grabbed me and said, "Daddy, I need to speak with you right now. It's very important." And I remember when I was a kid that my father always told me that he had, kind of a job that was complicated, and he ran a lot of meetings. He always said, if you ever need something, call and I'll leave a meeting. And so I've always aspired to do the same. So of course, everybody on the Zoom call could see my daughter doing this and hear her doing it. So I left the call, and we walked upstairs, and she had me try to rescue her from the smallest spider who's ever really lived. It was tiny, and I still didn't actually really see the spider, to be clear, but I think she just wanted to talk. And so we sat there and we talked about absolutely nothing, but she needed that moment. And I did too, to be clear, right? And so the thing I say to everyone in our teams, and my only piece of presumptuous advice is, whatever you have in this pandemic is good enough. And there are a lot of us who are being particularly judgy of ourselves and of our parenting and in this moment. And truly, none of us know what to do or how to be in moments like these. And whatever we have to give is good enough.
I think that's absolutely perfect way to end. Thank you both, Gary and Charlene, for all this great information and support that you're giving everyone as we navigate this. And to our attendees, we thank you very much for joining us this evening. Please know that we at Duke honor the commitment of the whole community to keep teens and young adults healthy and safe during this time. We value your partnership in this work. Take care, and wish you and your families all the good health. And thank you for joining us tonight, and wish you a good evening. Thank you.